Welcome to a demonstration of the Rome 4 Interactive Clinical Decision Toolkit. This new intelligent software system is designed to help practitioners achieve optimal clinical outcomes by helping them navigate in a sophisticated manner through the Rome 4 functional GI disorder diagnostic and treatment protocols. Using any browser-enabled device, physicians and clinicians can interact visually with the Rome algorithms. From the main dashboard, we can choose to learn or refresh our knowledge of a particular diagnostic or treatment component from the Rome 4 series. We can also choose to navigate these integrated protocols end-to-end. For instance, starting with the diagnostic process and working through treatment options using the MDCP to reach the final outcome. Let's begin by selecting bowel disorders. When we click on Bowel Overview, the information panel opens and we can see general information from the Rome 4 algorithms about this particular disorder. This content is identical to what you would find in the traditional Rome 4 algorithms booklet. This information panel is easily resizable, scrollable, and can be closed or opened as needed. Next, we'll select this first one, Patient with Recurrent Abdominal Pain. Note the breadcrumb elements that allow us to navigate back to any previous level. The first step is the patient's history and physical exam. Clicking this box pops up a prompt, while again the information panel slides open with relevant content. We'll select Completed. Notice the circle on this path has changed from gray to blue to show you it was selected, and the border around this element has become thicker to show that it's been answered. The next step asks if any alarm features were identified, and we'll answer no. Notice some elements are now faded because they're eliminated from the possible next steps based on our choosing no. We can always change our answer if we made a mistake, for example by clicking on the element again, and we'll choose yes this time, and you'll see our path change. We'll click the next element and choose yes. Alternatively, you can just click the circle after a decision point to select it, which we'll do for the next few. And then we'll complete this diagnosis by identifying IBS-C as the disorder. We can click the History button to see a summary of the decisions and pathway that we took. After reviewing it, we can copy and paste it into another application, such as email. Let's close and continue. Now we're done with diagnosis, we can move on to treatment, which takes us into the related MDCP treatment pathways. While you can access any MDCP from the top level of the application as you did the diagnostic algorithms, you can also use the diagnosis to connect to the corresponding treatment pathways derived from the MDCPs. When we enter IBS-C, you can see that the same interactive access to reference information is available at each node. In treatments, the MDCP pathways take us step by step through progressive stages in which multiple treatment options are presented for the clinician to review and recommend at their discretion based on immediate access to supporting information. In the case of IBS-C, as with most of the conditions, it is first recommended to consider if psychosocial factors are present and should be treated. We can select this option and you can see that it navigates you to a separate pathway for psychocultural treatment. You can navigate this pathway and return to IBS-C after selecting or reviewing options here. We'll simply indicate that there are no psychological factors to consider and the system will navigate us back to the IBS-C pathway where we left off. If we click and choose Mild, we are directed to a first set of conservative dietary treatment options. But let's go with the Moderate Severe option and navigate to a range of suggested medications. When we click on that treatment options node, the system brings up a calculator, which not only tells us the general options recommended, but allows us to envision or track the specific sequence of options chosen at this stage. Users will often use the Decision Toolkit as a reference tool at the point of care. Since treatment of chronic conditions is performed over an extended period of time, the system is designed so that your interactions in a particular case or scenario can be named and saved. This means you can start a treatment in a treatment node and then suspend use of the tool until the next appointment when you're assessing the efficacy and are potentially adjusting or adding other treatments. Let's simulate this. Using the treatment selector, we can select a treatment associated with this stage. Let's say osmotic laxative. Often you will want to track the timing of the overall treatment history so you can associate dates with any treatment decision. Let's start with today's date. Since we don't yet know how the treatment has worked out, we can indicate that the treatment status is not yet determined, and we tell the system that we are going to stay on this node until it's time to reevaluate. At this point, we would in reality save the case and do something else. When the patient comes in for the next appointment, we can start the system and reselect this case in order to be returned to the same point. For time's sake, we will not demonstrate this now. Now let's pretend that the laxative was not effective. We can at that point stop the treatment, and we could add prosecretory agents. As we stop the laxative, we note the date of that visit, let's say 3 weeks later. At this point, we can indicate that the treatment is not yet effective, and we can indicate the date we made that determination. As you saw already, that information will still be there when we return for the next session. Now, let's pretend that after 3 more weeks, there has been improvement. We can elect to continue prosecretory agents without modification, and we can note that the overall treatment is now partially effective. We can now navigate to the next treatment nodes. At this point, the MDCP recommends considering associated pain. We can indicate that there is moderate to severe pain and go to the next treatment node. Note that you continue to see all treatments that have been selected so far and their status. This allows you at any point in the application to make treatment decisions with a clear view of all concurrently active treatment options and the patient's reaction. In this node, let's initiate SNRI. We will stay at this node while we wait to see its effectiveness. Three weeks later, let's say the patient has returned and the pain is no longer present. At this point, you could determine that the overall treatment course has been effective. And you can now navigate to an endpoint indicating the treatment is complete. Now we've answered all the questions leading to a complete treatment assessment. Again, we can click History to see our algorithm summary, showing the entire path we took end to end, including the steps taken on earlier sections and all the treatments applied and their most recent status. This information can be easily copied into another application. Please note that the Rome Decision Toolkit can be acquired at an institutional level by healthcare organizations and can then be deployed in tight integration with their clinical workflow and the patient record, or EHR. When used by individual practitioners, as we have demonstrated here, the objective is to provide a means of tracking a process while easily copying results into the patient record.